Mental Health Commission needs authority to speak freely. Fels. Professor Allan Fels says the National Mental Health Commission he used to chair has lost the confidence of the sector and must be given the authority to speak freely about how billions in government money is being spent on the struggling mental health system. As mental health experts express alarm over rising suicide rates and call for broad reform ahead of a federal government roundtable on Monday, Fels warned there was little evidence about whether government funding for mental health was being used productively. The Commission should specify desirable outcomes such as measures of improved mental health, and then require the provision of information about how well those measures are being met, he said. But he said it was failing to do so because it was not truly independent and lacked the legislative authority of entities such as the Productivity Commission or the Australian Competition and Consumer Commission, which Fels led for 14 years before chairing the Mental Health Commission from its inception in 2012 until 2018. There's not a lot of confidence that the commissioners, acting as a commission, can speak freely and uninhibitedly. That is the key point, Fels said. The original concept was to set it up as an independent body that would hold the Commonwealth government to account and as a result enjoy the confidence of the community, especially the mental health community. Fels said that had gradually changed since the mid-2010s as its independence was downplayed and it took on a more advisory function. The Commission, which has $24.7 million in total resources this financial year, sits within the Federal Health Department and its chief executive reports to Health Minister Mark Butler. CEO Christine Morgan, who was appointed in 2019, was also National Suicide Prevention Advisor to former Prime Minister Scott Morrison until 2020. As Butler seeks to restore the mental health sector's confidence following an outcry over his decision to have the number of Medicare-funded psychology sessions late last year, Fels said giving the Commission statutory authority to independently scrutinize government would be one useful step. The government is still on trial, he said. I am concerned at the present environment which repeats history. Periodically, mental health has a brief rise to being very high on the policy priority list of governments and then it is very soon overtaken. There is an ongoing need for the Commonwealth government to lift its game on mental health, both in treating it as a priority and to get a better organized system, and the pressure from the Commission, if it has the right authority, can make a difference.